I read one of your papers that was really interesting to me. It was on dietary patterns and pathological eating behaviors, and it compared vegans to omnivores.
Yes, and I want to acknowledge my former PhD student, Courtney McLean, for that work.
Together, you guys found, and I have a quote here, that vegans displayed more pathological eating behaviors than omnivores, which was significantly predicted by cognitive restraint. However, body dissatisfaction levels were higher in omnivores than vegans. Let's unpack this a little bit. What is the significance of the link between cognitive restraint in vegans and pathological eating behaviors?
Yeah, and obviously Courtney and I have published quite a bit on that now, and I'm not even sure we have 100% the answer now. And I think the reason that that she was very interested in it was that, and she'll tell everyone this, that she was a vegan herself, and she didn't like how people assumed she sort of had an eating disorder just because she was vegan. And so throughout the course of that body of work over the last couple of years, we saw that certainly being vegan wasn't necessarily always linked to having an eating disorder. Some people are making these choices. And what we did find was that it was sort of the motivations behind the choice to be vegan that was crucial in the eating disorder risk. So if people were talking about it more from like an ethical perspective, animal rights perspective, that seemed to be less linked with eating disorders. If people were saying it was more to do with a health perspective, that was a little bit more health and weight loss. That was more linked with eating disorder pathology.
If studies were looking at incidence of eating disorders in vegan populations and they weren't considering the motivation for the people that were adopting a vegan diet, they may be kind of overestimating the incidence of eating disorders in vegans.
Exactly. And it's to do with our eating disorder questionnaires as well. Like there's some overlap in what a vegan would do normally, but also what is an eating disorder symptom. So that was the key, to try and disentangle that, and that there's still obviously more work to be done there. But before that work, I was always a little bit more biased in that I was always very concerned if someone was coming in with a vegan diet. I was like, oh dear, we're headed towards eating disorders. But it opened my eyes, and for that I'm grateful that I will always dig a bit deeper and go, oh, why? When did you start this? Did this precede the eating disorder, or was it during? So it's helped me, I think, ask better questions of patients and get a better idea of what's going on for them and their choices.
Yeah, I find this really interesting myself because I've been working with Megan Lee from Bond University.
Go Megan, a shout out to her. She's great.
Yeah. And we also became very interested in plant-based dietary patterns and mental health outcomes. And when we were reading a lot of the research that's been done in that kind of domain, not specific to eating disorders, but more broad kind of anxiety, depressive symptoms.
Yes.
A lot of the research is cross-sectional. So as you kind of just pointed to there, yes, it's not appreciating the temporal nature, diet changes or motivation for those changes.
And I think, yeah, this literature does suffer from, unfortunately, a bit of a lack of scientific rigor. And I'm really glad that yourself and Megan and others are really giving it that rigor so we can disentangle these relationships.
Yeah, one of the things that we're trying to do at the moment is set up a prospective study that has that kind of temporality built into it, so we can see how outcomes change over time as people do change their diet. Did I read that you and your team kind of developed a new screening tool for eating disorders within vegan populations that considers their motivation?
It is. It was published in Journal of Eating Disorders in January 2024, so it's recent compared to when we're recording this. So yes, it's available if people want to use it. There's more validation to be done, but if people are keen, they can absolutely have a look at it. It's open access.
Is there any clues as to why in that study of vegans and omnivores that you guys did, why omnivores had less body satisfaction? I think I read that.
So it was, omnivores had lower body satisfaction, wasn't it? And the vegans had higher. And I think we sort of potentially thought, well, vegans are sort of valuing their bodies, what they're putting into it. I suppose we sort of looked at that kind of vegan lifestyle, and potentially that was driving some of it. But our data couldn't tell us exactly, but I think that's what we surmised.
What are the best evidence-based practices today that we kind of have at our fingertips for treating eating disorders?
Yeah, and it is expanding, which is great, but I think there's a lot more to be done in this space. So generally, it's always recommended that eating disorders be treated by a multidisciplinary team. So that has the GP, the psychologist, the dietitian, the psychiatrist, I should say pediatrician for our younger folks. So that I suppose all facets are covered off on. And generally speaking, family-based therapy is considered best for children and adolescents. And then from an adult perspective, and with my psychologist hat on, it's cognitive behavioral therapy enhanced, or CBTE, is considered the gold standard treatment. And so people will be seeing their psychologists very regularly, once, twice a week sometimes. And the first step of it is really just that behavioral change, just trying to get regular eating initiated, because often people are sort of not eating for big periods of the day and then binging. And then we look more at the, I suppose, psychological aspects, the body image concerns, the overall self-evaluation. But you focus on behaviors first.
What's the kind of typical success rate of that gold standard treatment? If you take 100 people that have eating disorders, what percentage of people are able to overcome that eating disorder and then resume healthy eating behaviors?
Yeah, I mean, there's a few different figures on that, and I suppose I've seen relapse rates of up to 30% in some of this research. I mean, other studies will find other numbers. So it's certainly not 100% successful. And I think something that I'm very passionate about is understanding the biology or the biological mechanisms of eating disorders better, because I think pharmacologically we really haven't done enough in this space. So in the moment in Australia, we only have one medication for eating disorders that's TGA approved, and that's Vyvanse, an amphetamine. And that really, I mean, goodness gracious me, that's not really that good. So I think there are a lot of avenues still to explore, along with the psychology, psychiatry, dietetic support that would allow people to have much better recovery rates, potentially.
In that space, are there other drug targets or certain pharmaceuticals that you're kind of thinking of that would target different areas of the brain?
I mean, I think there are some really promising trials coming through. So particularly psychedelics, psilocybin in particular for anorexia. So I think what I've learned so far, and I should say I'm doing the training course right now, so I'm super excited about that, is that psychedelics can potentially allow people's minds to open up when they're previously kind of locked down and rigid, and maybe be more open to a kind of psychological therapy experience. So that's certainly one avenue. And I've got to be controversial here and talk about Ozempic, which is on everyone's radar. And I think, like, I am not opposed to people using these medications as indicated. So Ozempic is a GLP-1 receptor agonist. And there's lots more coming out now. So Ozempic was just kind of the first wave, really. But I would like to see, and I think the studies are running right now, but how does semaglutide or GLP-1 receptor agonists, can they help with binge eating disorder? So we know that it can obviously lower weight, it can help with diabetes, but does it actually help with binge eating disorder behaviors and the cognitions? So I'm excited to see that there's more coming through at least.
And the flip side of that, also related to Ozempic, I read an opinion piece, I think it was, of yours that you published, that was kind of emphasizing perhaps the importance of screening for eating disorders before prescribing Ozempic. Can you kind of unpack that for us?
Indeed. So because Ozempic has that really powerful weight loss ability, and I mean, it's we've got the best drugs now ever if you want to lose weight, but clearly weight and shape dissatisfaction are very core to eating disorders, and I'm just thinking of people who are in that normal weight range or even low weight range. If they were to get their hands on this, it would actually probably be quite a bad outcome because they are already normal or low weight, and it would potentially further perpetuate their eating disorder. And I think, people have been doing this for years with diet pills and stuff like that. So Ozempic could potentially be used as a tool like that.